Hi, it's Patrick Hutzel from intensivecareathome.com.au, where we help long-term ventilated adults and children with tracheostomy to improve their quality of life, and where we also help hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I raised awareness that Palliative Care Australia is calling for better end-of-life care services. You can check out the update if you click on the link below this video. In this week's blog, I really want to bring home another point that is close to my heart and close to the heart of our clients and their families. Why home care for long-term ventilated adults and children with tracheostomy is a basic human right. Now, if you have followed this blog for a while, you would have heard me talking about what our intensive care at home services can do for our clients and their families, as well what it can do for intensive care units and their respective hospitals. And in essence, just as when a patient requires intensive care or critical care for an acute illness, a long-term ventilated adult or child, as soon as medically stable, needs to go home into the safety and comfort of their own environment. It's a basic human instinct and it's a basic human right. Those basic human rights can be applied to long-term ventilated adults and children with tracheostomy in many situations, whether it's in a long-term weaning situation, or in an end-of-life situation, or in a situation where a patient might require a ventilator for some time to come, maybe even for the rest of their life. After having worked with so many long-term ventilated adults and children with tracheostomy in a home and in an intensive care environment, and also after knowing and understanding what the families of these patients want and need, it's more than overdue that current clinical and intensive care paradigms shift to a model that is more holistic, patient and family centered, more cost effective, and that's proven to be successful, as many other similar organizations to intensive care at home have proven in other countries a long time ago, and those organizations have built a proven track record to succeed in taking long-term ventilated adults and children home and provide a genuine alternative to a long-term stay in intensive care. It's also a basic human right to have choice where to be treated, and we should not limit our and other people's thinking to a hospital or intensive care setting only. Home care is the future, even in a high acuity environment such as intensive care, because a lot more is possible in a home care environment than you think it is. What are your thoughts on basic human rights for long-term ventilated adults and children with tracheostomy in intensive care? What do you think is the best solution? Leave your comments on the blog below this video. If you want to discuss your needs for your intensive care unit or for your loved one, feel free to give me a call on 041 094 2230. Thank you for watching this video. This is Patrick Hutzel from intensivecareathome.com.au, and I'll see you again in another update next week.